Hey everyone, welcome back to my channel. If you're new here, my name is Joel. I'm now a nurse graduate from San Diego State University and currently working in the ER as an RN. And for today's video, it's going to be patient introductions and why they're important. So I know that in nursing school we were taught that saying like, hello, Miss whatever, my name is Joel, I'm going to be your nurse today. Like, what brings you here? You know, very script based, right? But actually one of the things that I did notice was that it goes farther beyond than that, like those type of introductions. Once I was in the floor, and this is just my mentality or my mindset, I haven't really talked about it with anyone, but I did notice a pattern. And the pattern that I mean is that whenever I just go in pretty much with like just talking normally, nicely, it doesn't really do anything for the patients that I normally had. Like they always have like their shield up, I feel, or very anxious because obviously they're in the hospital. But once you put in like more charismatic approach, you're smiling to them more. If they're more like if you like to touch patients, like feel their shoulder or whatever, you know, make that type of touch. I did notice that definitely goes a long way. And also like if you go in and if you like know Spanish and English, asking them like, oh, English, Spanish, it can definitely help them out as well, because a lot of them, you just speak English, they really might not 100% understand you. And if you speak like okay English or very good English, definitely use that. And at least for me, speaking Spanish definitely makes the mood a little better, a little bit more at ease, a little bit less formal. And for some patients, they like that type of like mentality, or that type of, obviously having still being professional and everything with the approach, but speaking to them like if you're their family member in a sense, but in a professional way. I don't know about like the nicknames, about calling them like certain nicknames. Like in Spanish, it's very easy for you to call them madre or señora. Well, señora, I feel it's okay, but madre, you know, stuff like that. I don't feel that comfortable with that, but I really just say like señora or señor, or joven or señorita, anything like that. But definitely using that type of touch, or using the type of culture aspect that you already know from the patients that you're going to be encountering. So at least in the hospital where I work at, it's more like Hispanic, Latino. Majority of them are like Spanish speakers. At least like 80% of my patients, 85, or that prefer for me to speak to them in Spanish. I definitely feel that it's way better. It's way better. The experience, they laugh more, they feel a little bit more at ease, they feel more comfortable, which also helps with their stay in their experience, because they might feel like a certain type of barrier between like nursing and patient, because like you're just there to give them their meds, ask them some questions, and then you're out. You really are not there to like actually care too much about their emotions. And I don't know if that's like a big thing to say, but that's definitely the things that I've noticed. You know, it's you're just doing your job and then you're out. But if you try and put in those 5 extra cents of like you actually talking to them, letting them know why we're doing each thing in like a calm way, a good way for them to learn, in simple words, the less words and simple words, for them, in order for them to feel less anxious about like their stay in the hospital. Because sometimes, you know, they might be going, like a lot of things might be going on, and they're all anxious and panic, and their vital signs are even like skyrocketing just because they're anxious. But also like have the mentality like they're there as a person as well. They're a person, they have feelings, they like to know. If you were that patient, you would want your nurse or your doctor to like really let you know like why we're going to be doing these labs, what are we looking for, why we're giving them certain medications, how that's going to help them. And, you know, really trying to like keep them up, and not like just go in when you have to and then go out. You know, really try and like talk to them if you can, and you're gonna see like it's gonna stay with them more. Obviously if you have like a lot of patients and everything super chaotic, then definitely that type of experience is definitely going to be reduced or diminished, because you have a lot of things going on. Like you don't really have too much time to be like a friend nurse to them and explaining everything about what we're doing and why we're doing it. But you know that a lot of the times it's not that chaotic. You know, you can definitely stay an extra 3 minutes or 4 minutes and let it talking to them. But if you just have the mentality you're always busy and you have no time, then I mean, it's all right, I guess. Just letting you guys know about like how I feel about the introductions and how they definitely do make a better impact on the patients, because I have used that module or that framework mentality with patients that are hard patients, or they're super like needy. I use that type of framework, and it definitely makes their experience and my experience better. They're not always there because, you know, I answer all their questions there, and I'm letting them know what might be things that they might be feeling, when to call me, and signs and symptoms that might be normal. You know, I really let them know about everything in order to answer all their questions, and they don't need to call me every like 10 or 15 minutes for stuff. And you're gonna see like with the patients and the family members there, the experience that you have, like both of you guys are gonna see that it's way better. They're always gonna have like a better experience, and they're always going to be happy whenever they see you, because I have that multiple times happen to me where they bring me like another family member, their husband, their wife, or they're with another nurse, and then they see me and they're like, oh hello, like I brought now this person, and I'm like, oh okay, that's cool, but like they're not my patients. But you know, I have that happen a lot, that it's very nice. And then some other nurses tell me like, oh well, it's because like they sometimes have that nurse that they do like, but then they hated the other one. And it's like, well, you know, maybe like you never know, right? But also the way that you're talking to them, that's what I mean. You know, if you're talking to them so blankly and so like whatever, like you really are just there to do your job and then you're out, versus one that actually takes a little bit of time explaining them pretty much everything and like what they're feeling and validating their emotions, you're gonna see that obviously they're gonna have a better experience with that. So that's what I'm trying to say pretty much. You can try it out, and if you're really not a person that does that very well, you can definitely practice it out just a little bit more, seeing if they need anything, asking their family if they have like any questions, and yeah, you're gonna see like definitely goes a long way by you just doing these little things. But yeah, I just want to bring that out because it's not like a thing that in nursing school they really touch too much upon. They really go like very superficial, so really try and have that approach. And lastly, if nothing really stick with you, or if you like don't believe in that, also have the mentality like, if you had your family member there, would you be comfortable having yourself as their nurse, like that type of nurse, that type of your style? And if your answer is yes, then okay, then that's fine, I guess. No problem. But if your answer is like, well, no, I would want them to be like a little bit more charming, a little bit more empathetic, a little bit more they actually care, you know, then that's your answer to you as well, because the patients that you have there are a family member of someone there that you might possibly know, because I did encounter like a lot of family friends of mine that they told me later on, like after their care was done, like, oh, like, are you friends with so and so? And I was like, oh yeah, like, oh, I'm their uncle, or I'm their dad, or whatever. So definitely have that mentality, and definitely goes a long way, especially if you live in a town where everybody knows everyone. But yeah, having that framework definitely has helped me a lot, and being a better nurse, and also for them having that positive experience, which can definitely go a long way. So yeah, that's pretty much it. So if you guys stood here until the end of this video, thank you so much guys for watching. Let me know, you hear your comments, any type of like good experience that you had with patients, and like they've talked to you saying like, oh, thank you for explaining this, like anything regarding patient care, and them giving you feedback, like let me know here in the comments. And or also, if you don't feel comfortable with that, you can also message me on Instagram, so it could be like more like a private conversation, just letting me know and give me your thoughts about this, because it would be definitely like a good thing to discuss. But yeah, so that's pretty much it. So you guys stood here to the end of this video. Thank you so much guys for watching, and I'll see you guys in the next video. Bye bye.